The following Pharma Essentia podcast is intended for informational and educational purposes only and cannot be considered as medical advice. Please speak to a healthcare professional before making any treatment decisions.
Hey, Josh.
Hey, Kay.
Hey, Josh.
Hi, Kay.
Hey, Josh.
Kate, we always start with you.
We totally could have talked about that before we started recording.
Oh, hey, that's us.
Your intrepid hosts.
Oh, the fights that we have. Kay's been trying to get me to share my Netflix login for like a month now.
To share is to care, Josh.
Get your own account. You're 28 years old.
We don't fight that much, do we?
Well, only when you deserve it, Kay.
We usually start with an extremely funny bit written by yours truly.
Extremely funny is a little bit of a stretch.
Ouch.
Well, we've had some good times this year, too.
You're so right. All this to say, welcome listeners to another fantastic episode of the PV Pod, Stories from the Marrow.
With our annual year in review episode.
Brought to you by Pharma Essentia.
Thanks, Pharma Essentia.
Josh, I am so excited for this episode. It's been a great year of the PV Pod.
Agreed. Our first season on video, so you guys could see all of my incredible outfits.
Plus, so many valuable insights on living with PV.
We've had some really incredible guests this year.
Hi, I'm Dana.
My name is Saleh Shadid. I'm a hematologist and medical oncologist.
My name is Susan Brooks.
To name a few of them.
And we've been fortunate enough to have our guests come from all kinds of backgrounds.
I'm Chief Executive Officer of the Patient Empowerment Network.
I am a practicing psychologist, and I specialize in supporting the needs of patients and families affected by rare diseases.
I have been diagnosed with Polycythemia Vera since 2019.
So this year, we've really gotten a holistic look at living with PV, from doctors to mental health specialists, to professional patient advocates, to people living with PV themselves.
Plus 2 great hosts. What more could you ask for?
We are going to be reviewing all of the great highlights from Season 2 of the PV Pod right after this quick break.
So you're learning about PV on the PV Pod, Stories from the Marrow.
Now get ready to take the next steps on your PV journey with Piece Together PV. Previously, What's Next PV, an educational site on everything Polycythemia Vera. Though the name has changed, the mission remains the same: to empower people with PV to learn about their options, speak up, and make informed long-term decisions. Piece Together PV can help you understand test results, set health goals, and make a plan to advocate for yourself. Check out piecetogetherpv.com to learn more.
And we're back.
As always, thank you so much for sticking around.
Kate, we've had such a jam-packed year, I don't even know where to begin.
I know, it's a lot to take in, but I think we should start where I usually like to start. The beginning.
Initial diagnosis.
You got it. Dr. Shadid set us up really nicely with the signs and symptoms of Polycythemia Vera from a medical perspective.
It can cause sometimes burning pain sensation in your hands and feet. It can cause an enlarged, sometimes painful spleen in about a third of folks. It can cause just itchy skin in about a third of folks. About half of people have like a transient visual disturbance. So they can have it's called an ocular migraine, which can cause transient vision changes in one eye or another, blind spots, floaters, shimmering, that sort of stuff.
Along the way, some of our guests living with PV have given us anecdotal evidence of what Dr. Shadid is saying.
I had intermittent headaches.
I actually struggled with migraines.
Some facial flushing and some visual disturbances that I can best describe as rainbow-like lightning bolts, like out of the side vision, rainbow-like lightning bolts is exactly what it looked like.
So I just get the visual disturbances, like the light flutters or the visual flickering within my vision.
Looking back, terrible night sweats, terrible sweats, ache and pains.
I couldn't keep up on a family walk on a flat surface at the local park. Looking back at that was pretty significant.
Oh, that reminds me of another commonality that we see between our guests who live with PV. For so many people who've just been diagnosed, they have no idea that their symptoms had anything to do with something like PV.
Sometimes they might not even realize or associate that with the diagnosis of polycythemia vera.
My symptoms were very vague, but I didn't even know they were symptoms to address them.
So when I was diagnosed, I was pretty shocked and surprised.
I was in my mid-40s, right? So everybody tell you, you're getting older, things start hurting on you. And so I was like, wait a minute, it really is not that point.
Regarding these symptoms and any other symptoms you might be experiencing as someone living with PV, our guest Tracy Rohde had some good advice.
Often a symptom that they would never expect to have anything to do with either the disease or a side effect of the treatment is something that they really need to have told the medical team. So nothing's too small. Is it a cold sore or is it a side effect of treatment? Let your medical team figure that out.
Tracy's right. It can be hard to discern what might be the cause of your symptoms, especially when you're living with a rare disease like PV. So be sure to share any symptoms you're having with your doctor. I think I remember Dr. Masarova talking about that as well.
I cannot know what they feel. They have to tell me. And also, I don't know what other issues with the diseases come in terms of the fears. Again, all kind of burdens that the disease and living with the disease brings on. I tell them, journal, put down the concerns, put down how you feel, see whether that has a specific pattern, see whether we can understand. You wake up tired or you become tired at the end of the day. You're just tired regardless how tired it is.
Speaking of sharing symptoms with your doctor, one of the topics we've really gotten to dig into this season is the idea of shared decision-making.
Shared decision-making.
I shared my ideas with my hematologist.
Shared decision-making is a part of every visit that I make to my NPN specialist.
Oh, right. Shared decision-making. Could you remind me what that is again?
Shared decision-making is a very important tool that we use broadly in oncology. It's actually in between the active and passive decision-making, where either the physician or the patient make decisions. So it's in between. To me, that's kind of like a situation where physicians or clinicians would recommend and advise and kind of dissect the topics and then lead the patient together to come up with the decisions about care, really for the best interest of the patients.
We have to, find out what the patient's wishes are and what their goals of care are. So, most patients want to live longer, and at the same time, they want to have a good quality life. So, kind of honing in on exactly what's bothering the patient. So, is it the fatigue? Is it the visual disturbances? Is it the stomach ulcers? Is it the itchy, kind of painful kind of skin? Is it the risk of, developing blood clots and the long-term complications of those blood clots? So making sure that those are being properly addressed is very important.
I would say that shared decision-making is a collaboration between a patient and his or her providers with the goal of making decisions that are the best ones for the patient.
It's the connection between the involved parties in this level, the clinician and the patient.
Okay, now I remember. We've had some great examples of shared decision-making throughout the season when some of our guests were initially presented with a treatment plan that didn't align with their goals in regards to living with PV.
I was initially placed on a watch and wait approach due to my younger age and general good health, but I didn't really want to wait for something bad to happen in order to get ahead of my PV.
So maybe your proposed treatment plan isn't as aggressive as you'd like it to be.
I gathered all the latest breaking research on what my diagnosis was, which was Polycythemia Vera. I gathered all of that research and I brought it into my follow-up appointment. But he said he was not going to treat me with any interferons. He would rather put me on a chemotherapeutic pill. That came as quite a shock to us.
Or maybe your proposed treatment plan doesn't align with what you've researched about your diagnosis. Regardless, you are always allowed to seek a second opinion.
And as we were leaving, he said, you are more than welcome to seek out a partner of mine, an affiliate of mine at the large university hospital down the road. And that's immediately what we did.
Either way, shared decision-making is all about being respected and heard by your care team.
We all are incredibly fortunate when we find a team of medical professionals to walk with us on our cancer journey that we really see eye to eye.
My doctor values my input and always allows me plenty of time to ask questions before any changes are made to my treatment plan. The pros and cons of each decision regarding my PV are discussed, and then we come up with the best plan of care for me. So it's made me feel that my opinions and concerns really do matter.
Not everyone has that experience at the beginning. Some people don't have that experience as they move into treatment. What I want you to know is that you have the right to expect care that's going to make you feel comfortable and confident and feel like your opinion is respected.
Shared decision making is a key element of another big topic of season 2.
I have a guess as to what that big topic might be.
Self-advocacy.
Self-advocacy.
Self-advocacy is key.
You're your best advocate.
Patients are the best advocates.
Be your own advocate.
Did you guess self-advocacy?
Honestly, I guessed Facebook, but this is way better.
This year, we really got to explore how you might advocate for yourself while living with PV, with shared decision-making being a great tool in your self-advocacy toolbox.
Well, let's crack that toolbox wide open, Kay. What are some other self-advocacy tools our guests have recommended this season?
Josh, I'm glad you asked.
That's an important part of self-advocacy. It's just educating yourself.
I had to start educating myself.
Just educate yourself. I think education is key. It reduces the anxiety of I wonder or I don't know. And I feel like when you have more answers rather than questions, you always feel better.
You know, we all walk into the oncologist's office for that first visit feeling like, am I going to understand the words they're using? Especially with PV, you may have never heard of it before, so you're trying to understand the sort of the lingo that comes with a PV diagnosis. And just the thought that you come in, that you can understand, you can learn to communicate with your physician. You're never going to trick anyone into thinking that you're a hematologist, but you absolutely can have the very important role that patients who get the best care have in making decisions about that care.
Tracy put that so well, and it links back to how self-education aids you in shared decision-making.
By educating yourself, you are better able to communicate with your doctor about your preferred treatment plan and your diagnosis in general.
Taking time between office visits to learn of new studies may lead to some concerns or questions you may want to run by your doctor at the next visit. I think that it allows you to keep up to date on the most current PV information, helps you to better advocate for yourself, and allows you to remain an active member in the shared decision-making between you and your healthcare team.
So we know it's important to get educated about your diagnosis.
Yep.
Why don't we review some of the ways our guests have talked about getting educated? I mean, there's so much information out there, it can be overwhelming to get started.
Great suggestion, Josh. Have you been doing this for 2 seasons now?
For someone who's just been diagnosed and really trying to educate yourself about PV, just know that you're probably going to get inundated with ads and suggestions and AI, all kinds of inputs of information. But the most important thing for you to realize is not every resource on the internet is credible. So looking for information at PV-specific organizations, the companies that make PV drugs usually have great information. Organizations like the Patient Empowerment Network, while we cover many different types of cancer, we do have some specific information about myeloprolific neoplasms, which is another word you all got to learn after your diagnosis, because PV is one of those. There are so many resources for patients with PV, and the list is growing every day. From organizations like Blood Cancers United, which used to be known as the Leukemia and Lymphoma Society, to a variety of myeloprolific neoplasm organizations that have more specific information. And there are a number of support groups and organizations that have PV specific information. American Cancer Society, Patient Empowerment Network, the Cancer Support Community, many of those have links on their websites to other resources for PV patients.
As well as internet-based resources, over this past season, we've talked about the benefits of attending in-person events like PV in Focus. You can go to pvinfocus.com to sign up to receive information about upcoming in-person events, which will be taking place all across the country in 2026.
So I happened upon a patient conference last fall in New York, and during the Q&A session, with MPN researchers. I explained how my quality of life had been so negatively affected with the anemia, and was there any hope for someone like me? They all agreed unanimously that I needed to take a supplemental iron, and as soon as possible. I took that information back to my hematologist oncologist. I have a ton more energy, and overall they're very pleased. The second example I could use is through the patient conference. I was able to find out that there is a specialty called cardio oncology, and that there are practitioners throughout the US. It's a new field, and so I went to the cardio oncologist. She was very aware of the anti-inflammatory properties, and we are currently working on increasing my dose and being monitored.
By attending a patient conference, Susan received education that helped her update her treatment plan. Self-advocacy and shared decision-making in action.
In-person events are not only beneficial for their education, but also for the community. Living with a rare disease can be isolating, and it's important to know you aren't alone.
I think most patients find it really helpful to connect with their rare communities.
I'm very active on a specific young patient support group, PV support groups, and my specific treatment support group online.
You see some amazing people who carry themselves with a lot of grace and dignity. And when you're a new patient or caregiver in rare disease, you look up to these people.
When you feel personally supported in your journey, you feel so much less alone and so much more empowered.
The group of PV patients I met with recently included a couple of patients who had been recently diagnosed. And their experience being in the room was very different than the patients who'd been diagnosed for years. And what I see over and over again are experienced people kind of taking in under their wing the people who were new and scared, and helping them to feel less scared and to feel supported by sharing their knowledge of the medical condition, the knowledge of the professionals, the doctors who take care of them, and their strategies for how to get used to the changes that they need to make to take care of themselves medically. In those interactions with other people,
The best tip that I can give you from my own journey and from that of the wonderful, amazing, inspiring PV patients and care partners that I've been fortunate to meet is to know that you're not in your journey alone. And sometimes the event that makes you feel like you can really get through this.
It's all about community and getting a sense of connection with other people who share a similar diagnosis and experience.
And if you can't make it to in-person events, there are patient communities available online too.
Join the webinars. Join the social media groups, such as the PV-related Facebook groups.
I quickly saw a community of young patients like myself through various Facebook support groups and felt much more at peace.
There's a wealth of information on the websites and the social media groups.
I was not a Facebook person, and PV made me a lot more Facebook person, type thing, especially supporting people.
Other patients are so supportive that you could reach out to them personally if the offer is made and learn a lot about their journey that has probably gone before your journey and could help allay some of your fears.
But your community doesn't have to just be other people living with PV. Our guests this season have also emphasized the importance of building a network of your friends and loved ones to support you throughout your PV journey.
it's important that we have extra help if we need it.
When I was more supported by my husband and my friends, I felt like my physical health and my mental health both improved.
Hopefully you have someone with you, even if it's not the person who's going to be in charge of helping you get to appointments, maybe helping you with day-to-day issues that you may not feel well after treatment and need a little help bringing groceries in or something like that.
Our best friend, she's a 3-time cancer survivor. Breast cancer. So I had a pretty strong silent partner.
Support can come from all kinds of places, and what's most important is to know that you are not alone.
Josh, this has been such an amazing season filled with great advice on how to navigate living with PV.
I couldn't agree more.
Something we've done at the end of most episodes is ask our guests if they had any last pieces of advice they wanted to share with our listeners.
Sounds like a great way to close out this episode.
Guests, take it away.
I will say this forever, but advocate, advocate, advocate. Don't be satisfied with the watch and wait protocol. I felt like that was something I questioned from the beginning because I was told, just watch and wait. We'll just do therapeutic phlebotomies, which honestly made me feel miserable. I was iron depleted. I couldn't exercise. I couldn't take walks without huffing and puffing. That was my watch and wait. And I was like, no, this really isn't sustainable for me. So I feel like it's really important to research medication options, even clinical trials, if those are an option in your community, and other opportunities with your doctor to get ahead of your PV diagnosis to hopefully avoid disease progression.
This is not a static disease. In some patients, this gets worse over time. The itchy skin, the night sweats, the fatigue that's so severe you can't work, that can sometimes get really, really severe in some patients. And so, keeping in contact with your provider and just making sure that that your disease is being monitored, and that if you are having symptoms that are really bothersome to the patient, that we're addressing that on an ongoing basis.
You have the right, and you even have the responsibility to advocate for yourself, because the best care comes when there is a balance of power between the medical professionals who are delivering the treatment and the patient who's receiving the treatment, with your care partner by your side, your co-survivor, your caregiver, whatever term feels authentic to you and your family and your friends to call that person. But just really embracing, just as we're going to embrace from day one that we're a survivor, we're going to embrace from day one that you are able to be a decision maker in your care.
I would suggest to patients nowadays to really listen to what they want, to set their goals, to connect maybe with the community, with different peers within the social groups, with patient powers organizations, advocates organizations, to explore how others either approach the disease or what the options look like, raise the concerns.
I would tell patients to, seek out patient assistance programs to help with out-of-pocket costs of their medication. And I would also advise them set up accounts with organizations that relate to blood cancers. There are several organizations out there, Leukemia Lymphoma Society, Cancer Research and Treatment Organization, Rare Diseases. They hold resources that you otherwise would not come across.
Educating yourself, because ultimately you're your best advocate. But at the same time, your loved ones. And my wife and my relationship, I'm the stronger researcher. I do a lot of that for my job. So me digging into core causes and things and information, it's just part of my daily function. So I jump into it.
I'd also encourage those newly diagnosed to make sure not to forget about your mental health. It's really difficult living with a chronic illness for which there is no cure. So maybe take up a new hobby or learn mindfulness and meditation, or just simply allow a certain amount of time each day to reflect on you, your personal journey, and how you can make the best life for yourself, both mentally and physically.
The last thing to share is simply anything is possible. To stay as hopeful as you can in the face of these challenges, and know that there are plenty of positives too. It's not easy. Having a rare disease isn't easy. Being a caregiver is not easy. Everyone starts in a place of fear. And again, I wish for all that are listening to this podcast that you're able to move from a place of fear to a place of hope.
Kate, we've had such amazing guests this season.
Agreed. And I am so glad we had the opportunity to revisit their helpful insights all in one go. It's like a masterclass in how to handle some of the more common road bumps people face when navigating their PV journey.
Do you think we might be able to give our listeners a little sneak peek about the next year of PV Pod? I'm just really excited about it.
Of course, I am so looking forward to 2026 with the PV Pod because we are evolving.
Yeah, I'm thinking about dyeing the beard. My wife says blonde, but I think blue would suit me really well.
That, and we'll be expanding the show to highlight stories from people living with, caring for, and treating essential thrombocythemia, or ET, which is another myeloproliferative neoplasm.
Whoa, that's way more relevant than the beard change. I can't wait to learn about ET.
I know. And of course, we'll continue to feature Polycythemia Vera stories as well.
Ugh, great. I love hearing from the PV community.
Me too.
A big thank you to all our incredible guests this year. We couldn't have done it without you. I mean, literally, it would just be Kay and I talking, which is fine. I think we're kind of funny, but that's not really
And thank you, as always, for tuning into the PV Pod, Stories from the Marrow,
a podcast about Polycythemia Vera.
We'll see you next time. The PV Pod, Stories from the Marrow is produced by Believe Limited and Bloodstream Media, and made possible thanks to our sponsor, Pharma Essentia. The PV Pod is hosted by me, Kay Vermeil, and my co-host, Josh Bragg. If you like the show, please share it with anyone for whom it might make a difference, and leave us a rating on Apple Podcasts or Spotify. We'll see you next time.